Namaskara. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned Dr. Uday Patel, who has put in 32 years of service as an ophthalmologist. More than that, he has been in charge of the mobile ophthalmic clinic for 16 years, and he has done more than 1,000 screening for the eyes all over Gulbarga and North Karnataka. And apart from that, he has conducted free eye operation for 50,000 people, and that too implanting the intraocular lens in these 80% of these patients. And he has given light to thousands and thousands of patients. But today he's here to tell us how to take care of the eyes in the newborn babies and the young children. He is also a writer in English, Marathi, and Kannada, and he has been a very adhyatmik jivi. So welcome to our show, sir. Dr. Uday Patil, welcome to you. Namaskar.
Good morning, madam. Good morning.
Good morning. Yeah. Everybody thinks that the eye problem means when they are old and when they have the cataract, but it's not so. Even the newborn baby can have some problem. What are the common problems, and when the mother has to come to you, please tell us, sir.
Before starting, let me salute you, pranam, because you are my teacher in Hubli. And today is 1st July, B.C. Roy's birthday and death day. It is a doctor's day. And I respect you, I salute you, and I will start my TV interview. Madam, as you know, there is a Sanskrit slogan, Sarvendriyanam Nayanam Pradhanam. God has given us 5 indriyas. Among this, eye is one of the most important. And
Yes.
without eyes, we cannot enjoy the world. So the eye care should start not, as you told, not in the old age. It should start right from birth. So many nowadays, we see many deliveries are being conducted in hospitals, unlike in the olden days where they were home delivery very common. And I have noticed many newborn babies coming to me with their mother. Doctor, this child has got watering of eye for so many months. Only one eye. Usually they come with one eye and with the mucopurulent discharge. So what we should do? And they have used some antibody drops, but they haven't got the relief. The problem here is, madam, usually it is one of the congenital problem, I would say. God has given us the beautiful eyes, and there is a lacrimal gland which takes care of the eye by secreting lacrimal fluid, just like a tears, and it washes the cornea, gives nutrients to the eye, and the water which passes through your lacrimal sac into nose and then to throat. This is a natural phenomenon. There is some obstruction in this pathway. Usually, commonest site is here from the eyes to nose, nasolacrimal duct. There is small obstruction. Because of that obstruction, the tears they cannot go into the nose. They come back in the eyes and they get collected there and they get infected in the form of conjunctivitis, which is mucopurulent. And mere use of antibiotics will not help here. What the mother has to do is she has to give gentle massage on the lacrimal sac area, 10
like
to
this.
15 times gently without her nails, because the child, if she doesn't go, she may injure the cornea also. So
Yes.
take out your nails, trim your nails, clean your hand, give gentle massage on the lacrimal area 10 to 15 times for a period of 6 to 18 months. Then naturally, the duct, there is obstruction, it gets opened up. Otherwise, she needs a small surgery called probing we do from nose. Otherwise, usually by 18 months, I have seen 80% of the child, it gets all right. The duct opens and the problem is solved. This is one of the commonest problem of congenital, that is the nasolacrimal duct obstruction.
Okay.
One minute.
Okay. And apart from that, this watering is a common problem, and the mother can prevent it, and they can also come to the doctor and get it treated and do not allow it to go for the surgery. And apart from that, many children are born with the squint. And there is a wrong notion, the myth among the people that the squint is bringing luck to the baby or their family. What do you say about this squint?
Squint, madam, is one of the commonest eye problems I have seen in each growing child. The commonest cause of squint is unchecked refractive error. The
Okay.
child, usually the child has got binocular vision, both eyes are normal. Sometimes one eye is having some refractive error. Either it is
Okay.
myopia maybe, or high hypermetropia. And the eye which is going having the refractive error, not able to focus the objects. So it goes for
Okay.
rest, squint.
Okay.
So that
Okay.
child should be recognized as early as possible and should be give treatment. And for
Okay.
us, a common man, there are four O's we say. One is
Hmm.
optics, that is correction of the refractive errors. Second is occlusion, occlusion of the normal eye, so that the eye which is weak start working. You get
Okay.
stimulus. Then
Okay.
orthoptics, straightening of the eyes. Last is operation. This is what was taught by my teacher in Hubli. It is
Dr.
I will
Vatsala
call as
Dhronarayan. She's a good friend of
Vatsala
mine too.
Dhronarayan madam. She still I remember, though I will not do surgery, but first two O's I am still practicing. The commonest cause is unchecked refract should be covered, diagnosed. The child may not cooperate, put some cycloplastics and we do refraction, retinoscopy, and what the
Hmm.
number we use, we just give to the mother, ask her to use for the child. And
Hmm.
normally the refractive error is checked, the screen gets automatically corrected.
Corrected. Yes. So
That is
that's a
what
really
as a
nice.
public.
So people should not think that squint means it's surgery. No, just
No,
correcting
no.
the refraction, the squint can correct itself, and that's a
Yes, yes.
wonderful thing. But today, it is a big menace. The mobile has made the children immobile, and as a result, the refractive error and so many other problems are occurring in the children. So please explain. This is a very important and the burning problem. Please explain to our audience what exactly the mobile can do and what effect will be there on the eyesight.
Mobile use excess should be avoided for the children, because if you look the mobile for hours together, even we adults, the radiation, the light which comes from the mobile, it
Mm.
dries up our corneal tear film, and we get lot of eye problems, blurring of the eyes, headache, and you have to use lubricant eye drops. And this excess use of mobile I have seen in children is one of the commonest causes of unchecked refractive errors, because of the corneal problems they get. So the
Mm.
cornea gets dried up. It doesn't get the proper lubrication. The tear, whatever the tear is secreted, is evaporated by the radiation coming from the mobiles. Excess use of mobile should be avoided. And nowadays, in the COVID period, they have started giving even notes to the children on mobiles, which I have been visiting many schools and advising teachers not to give notes on mobiles. Let them
Okay.
develop the hand-eye coordination. As we were studying, right on the board, blackboard, let the child take on the notes, and this is one step. Then again read, again do hand and eye coordination. And excess use of mobile should be avoided, especially in the growing children. It has got a lot of problems, not only eyes, social problems and other. They got addiction like your drugs. Though the child gets addicted, so addiction, you know what are the problems of
Yes.
addiction. So
Yes.
excessive use of mobiles, I always do not advise.
Okay, sir. In fact, you rightly said it is not just the eyes. The whole mind and the brain development also can be affected by this mobile because of the electromagnetic waves. And another thing
Yes,
is, once they get addicted, they spend all the time in that. And we have
yes,
seen their sleeping pattern has changed because of the mobile. And this screen time, if it is more than half an hour, it is very bad, especially
yes.
up to 5 years. They should not give any mobile to the children, and even after 5 years, half an hour to 1 hour, that is okay. That is even up to the college going students. But more than that, what happens is their creativity comes down, their learning comes down, their intellect development also comes down, and as a result you are making the child dull, and not only dull, not reacting to the people or smiling, or that social behavior pattern itself gets changed. So I think the mother should realize that right from the child which is born till the child grows up, it is better to take care of the eyes, because the eyes are very important for the evolution of the mind as well as our personality. And thank you very much, sir, for giving such a wonderful thing. And one more thing, sir, nowadays this rubella syndrome has come down. But as a pediatric cardiologist, I have seen the children with the rubella syndrome, with the cardiac problems and the PDA, as well as the congenital cataract. What do you say about it, sir?
Rubella is one of the nowadays the incidence has come down. Even then we see now and then it is rubella causes congenital cataract, madam. Cataract should we call it leukoporia. When the child a pediatrician sees there's a white pupillary reflex, and that should be immediately treated, operated. Otherwise, the eye becomes blind, goes for amblyopia. But
Yes.
fortunately, because of our government's so many schemes, rubella disease has
Vaccine has
incidences
been given. Yes.
come down. We hardly, very rarely we see, nowadays we see traumatic cataracts in children, very commonest causes, and
Yes.
other congenital cataracts, not due to rubella. Common causes your congenital cataract, traumatic cataract we see nowadays. Rubella
Yes, sir.
syndrome.
Yes, sir. That is thanks to the central government, which has added rubella vaccine into the Indradhanush, where they are giving the 7 vaccines free of cost. And because of that, the German Dadar or German fever, which is called as the rubella fever, has come down. And not only the cataract, the other problems, the cardiac problems also will be there. So the mother should take care. If the child's eyes are good, and then learning process will be better and the child will be better. Sir, for the betterment of the children, you have taught the mothers how to take care of the eyes of the children. And not only that, you have opened the third eye, that is the awareness eye. Thank you very much for your kind disposition, sir. Thank you.
Thank you, madam.